In 2010, TB changed my life. I was working as a nurse in Kenya and experienced the suffering that TB patients go through. And then, I contracted multi-drug resistant TB. My name is Naomi and I've been working as a healthcare worker for 15 years. And I am a TB survivor. I'm honored to be here after having survived two pandemics this century. One that has taken the world's attention, COVID-19, and another pandemic that is silently killing 1.4 million people every year, with 10 million new infections reported globally every year. Yet the world has continuously ignored the leading infectious killer before COVID-19, and that is TB. Dear delegates, it is criminal that while TB has been around for centuries, this curable disease is still killing millions of people. It is a shame that, due to complacency, the world is fighting two pandemics and shifting most of the resources to the newest infectious disease. My brothers and sisters in countries like India have borne the brunt of lack of political will and attention to TB, and this has resulted in mass stockouts and major gaps in TB care. The strain, despair and loss of frontline healthcare workers like me could have been avoided. The commitments made at UN high-level meeting in 2018 gave us hope. Yet the report, Deadly Divide, Commitment versus Reality, by Stop TB Partnership, showed that targets are being missed. Today we have gone back 12 years in terms of people diagnosed and treated for TB. I urge all delegates to keep the promise made at the UN high-level meeting and invest in community-led TB responses. Each country should implement a TB response plan to mitigate the impact of COVID-19 on TB. Both diseases present with similar symptoms, and each person with a cough should be evaluated for both TB and COVID-19. We need to find high-risk asymptomatic groups and test for TB, with follow-up TB treatment or TB preventive therapy for household and especially children. TB stigma reduction intervention should be funded to ensure that it is community-led, rights-based, and gender-responsive. A number of high-burden countries rely on Global Fund as their main financier. TB kills 60% of people across HIV, TB, and malaria, yet the Global Fund provides 18% of funding to TB, when we really need at least 33%. We saw the political will in the Act A Facilitation Council that raised 30 billion in 18 months, thus providing resources to contain COVID-19. Where was that money, and why was it not available for TB? Let us place TB at the center of airborne pandemic preparedness and response, and truly end TB by 2030. Thank you.